Now let's start with our final section of the lecture, which is Antrochoanal polyps. In this, we will talk about the antrochoanal polyps, where they are formed, developed, and how they present. What are the signs and symptoms of antrochoanal polyps? What's the differential diagnosis? What are some other diseases or masses from which they should be differentiated? And what's the treatment of antrochoanal polyps? Antrochoanal polyps, they develop from mucosa of maxillary antrum near accessory ostium. So as the name shows, antrochoanal polyps, because they develop from the antrum of the maxillary sinus. So from mucosa of maxillary antrum near accessory ostium. Os is the term used for opening or ostium. So accessory is the not regular, it's the accessory structure which is present, so near the accessory ostium. Three parts of antrochoanal polyps. We have the antral part, which is the thin stalk. Thin stalk is the antral part of antrochoanal polyps. Then we have the choanal part, which is round and globular. So this is like a stalk. Then round and globular choanal. And the third is the nasal part, which is flat from side to side. So three parts of antrochoanal polyp. We have the antral part, which is the thin stalk. Then we have choanal part, which is round and globular in shape. And then the nasal part, which is flat from side to side. So antrochoanal polyp. Symptoms and signs of antrochoanal polyps. The etiology is unknown cause. Cause of the antrochoanal polyp is not known. Allergy and sinusitis is one cause that can be considered, that it might cause the antrochoanal polyps, because allergy and sinusitis is associated with ethmoidal polyps, so it might cause the antrochoanal polyps, but the exact clear cause of antrochoanal polyp is not known. It is single and unilateral. So that's the another very common difference between ethmoidal polypi and the antrochoanal polyp is antrochoanal polyp is single and it is only on one side, it's unilateral, as compared to ethmoidal polyps. They were multiple and they were bilateral on both sides. Symptoms are unilateral nasal obstruction. Bilateral is rare because they are present on one side, so the obstruction is caused on the one side. Hyponasality is also present. The voice is affected, sound is affected. That's all on the low side. Nasal discharge, which is mucoid in nature, is present. The signs of antrochoanal polyps, we have large grayish mass present. There is protrusion of polyp from the nose. The nasal, you can easily see the polyp through the nostril when you elevate the nasal bridge, because it is large grayish mass. It's not pink, reddish, it's grayish mass. There is nasal discharge. The unilateral obstruction. What are the causes of unilateral nasal obstruction? We divide them into the causes in the vestibule, in the nasal cavity, and then in the nasopharynx. So causes of unilateral obstruction in the vestibule is furuncle, vestibulitis, stenosis of nares, atresia, nasoalveolar cyst, papilloma, squamous cell carcinoma. All these are the causes of unilateral nasal obstruction of the vestibule. They are because we have antrochoanal polyp also cause unilateral nasal obstruction. So we are going over the other causes of unilateral obstruction that can be or that should be differentiated from the antrochoanal polyp. So in the vestibule, causes can be furuncle. All these can present as the growth or masses, so they should be differentiated from the antrochoanal masses. Then in the nasal cavity, the causes might be foreign body, deviated nasal septum, hypertrophic turbinates, concha bullosa, antrochoanal polyp, synechia, rhinolith, bleeding polyps of septum, benign and malignant tumors of nose and paranasal sinuses, sinusitis unilateral. So all these are the differentiating features or differential diagnosis that should be differentiated from antrochoanal polyps. Then in the nasopharynx, the cause of unilateral obstruction is unilateral choanal atresia. So all these are the causes of unilateral nasal obstruction that should be differentiated from antrochoanal polyp. Then bilateral nasal obstruction, some causes of bilateral nasal obstructions, even though antrochoanal polyp is usually the unilateral polyp, the bilateral polyps are very rare, but some features that or the causes of bilateral nasal obstruction we should know for as a differentiating point. Bilateral vestibulitis, collapsing nasal alae, stenosis of the nares, congenital atresia of the nares. Then the nasal cavity has acute rhinitis, chronic rhinitis and sinusitis, rhinitis medicamentosa, allergic rhinitis, hypertrophic turbinates, DNS, nasal polyps, atrophic rhinitis, rhinitis sicca, septal hematoma, septal abscess, bilateral choanal atresia. So all these are the causes of bilateral obstruction in the nasal cavity. Then in the nasopharynx, you can see adenoid hyperplasia when adenoids are enlarged, large choanal polyp, thorn wall cyst, then adhesions between soft palate and posterior pharyngeal wall, large benign and malignant tumors. All these are the causes of bilateral nasal obstruction, even though it's bilateral nasal obstruction is not common with antrochoanal polyps. Differential diagnosis is the blob of mucus, hypertrophied middle turbinate pink and hard feel, angiofibroma form and bleed on probing. Some differential diagnosis factors which antrochoanal polyps should be differentiated from blob of mucus, hypertrophied middle turbinate, which is usually pink and hard feel, but as compared to that, we mentioned that antrochoanal polyp is grayish in color. Angiofibroma is form and bleed on probing because it's from the blood vessel. Other neoplasm can be distinguished by the appearance, nature, and bleeding tendency. Now, the treatment is removal of the polyp by avulsion, twisting. If recurrence, usually Caldwell-Luke operation is performed, and then endoscopic sinus surgery to remove the polyps is also done. Differences between antrochoanal and ethmoidal polypi, there are some very clear differences between the two types. First, antrochoanal and then ethmoidal. Age, antrochoanal is common in children, ethmoidal is common in adults. Etiology, what's the causative factor? Antrochoanal is due to infection and ethmoidal is due to allergy or multifactorial. Number, we already mentioned antrochoanal, they are single or solitary, ethmoidal, they are multiple. Unilateral antrochoanal, bilateral ethmoidal. Maxillary sinus near ostium, ethmoid sinus for the ethmoidal. Growth grows backward to the choana, may hang down behind the soft palate. Mostly grow anteriorly and present at the nares. Size and shape, antrochoanal is tri-lobed, three-lobe with antral, nasal and choanal parts. So three parts of this is tri-lobed, antral, nasal and choanal part. Choanal part may protrude through the choana and fill the nasopharynx, obstructing both sides. Usually small and grape-like masses. So because they are multiple, they are small and grape-like. This is tri-lobe, solitary, three lobes are present. We have antral lobe, we have nasal and choanal part. Recurrence, antrochoanal, uncommon recurrence if removed completely. In ethmoidal, it's common. Treatment is polypectomy, endoscopic removal, or Caldwell-Luke operation. For this also polypectomy, endoscopic surgery, or ethmoidectomy, which may be intranasal, extranasal, or transantral. So these are some differentiating points between the two types of the polyps. That was all about the antrochoanal polyps. Thank you for watching sqadia.com.